name is Dr. May. Chronic joint pain is a very common disease. And among all the treatments people resort to, the use of painkillers rank number one. Either the person buys from the chemist, from the pharmacy, or even when you visit the doctor, is among the drugs the doctor might prescribe for you. But do you know that the painkiller you are taking might be contributing to the worsening of your arthritis? And that's what we are going to discuss today, why prolonged use of painkillers is very bad for arthritis. And these are the drugs we take. When we talk about painkiller, for this lecture today, we are concentrating on the painkillers that are known as NSAIDs, non-steroidal anti-inflammatory drugs. They can come in different brand names, but under that brand name, these are the chemicals they contain. Either aspirin, diclofenac, ibuprofen, ketoprofen. When you look under that brand name, you will see any of these drugs, and these are known as NSAIDs. Okay? Before we go into how they complicate arthritis, I need to let us understand what the body can do, especially when the body is having one problem or the other. The way our body is made, our body has that inherent capacity to heal itself. If it is wound, there are certain degree of wounds our body can handle. Okay? Depending on the type of the part of the body the wound occurred, that wound can heal within 1 week, 2 weeks, under 1 month, or over a month or so. So with that, some tissues of the body, or the tissues of the body, are classified into 3 types. There are those who call the labile tissue, there are those who call the stable tissues, there are those that are called the permanent tissues. The labile tissues are those who are renewing themselves on the regular basis, like the skin or the mucosa, like the lining of our mouth, or the intestine. So if I have a mouth sore, maybe I bit my tongue or I bit my lips and all that, within 1 week it goes. It goes because this part of the body is regenerating itself. So as it regenerating itself, it's easy for it to heal up those wounds. So if I have a cut in my skin, it might not take up to a month because the skin regenerates itself every 28 to 30 days. Okay? So these are known as the labile tissues. There are those that are a bit stable. They don't heal that fast, like the ligaments, the bones, the cartilages. They take time to heal. Sometimes they need help for them to regenerate. And there are those that are classified as permanent tissues, like the nerves. We used to believe that nerves, when they are damaged, they are damaged. But with advancement in medicine, we have found out that the nerves can regenerate. The brain can regenerate. Okay? So, in terms of regeneration, let's look at this tissue, which is the hyaline cartilage. If you look at this hyaline cartilage here, it is smaller here and it has grown bigger here. And how did it grow big? Okay, so this is the hyaline cartilage. Inside it is the substance we call the matrix, or the ground substance. Inside that substance, you see the cells of the cartilage. The cells of the cartilage are known as chondrocytes. It's just like, imagine you pour groundnut inside water. So that water is like the ground substance, and that groundnut is like the cells. Just to easy to illustrate. Okay? So if anything happens, or if this tissue or the cartilage wants to grow bigger, it does that through the process of proliferation, and that's what we call regeneration. Proliferation is where the cells begin to divide. One cell divides into 2, 4, 6, 8, 16, and all that. So as it's dividing, like these chondrocytes, they have divided, producing younger cells, younger cells, and with that tissue is growing bigger and bigger. So imagine this tissue or this hyaline cartilage had a wound. As it's developing and growing, it will cover the wound. And that wound has healed through the process of what? Regeneration. Okay? Now, the body, just as I used the skin to explain, every 30 days, new tissues cover the top of the skin. There's a way you rub your skin and you see some dead tissues coming out. These are the topmost part of the skin that are about to wear off. They will naturally wear off. When we bath them off, so new ones will come in. So there's always the death and regeneration of new cells, which is like a cycle. Each one balancing each other. So as long as they are in equilibrium, the tissue healthy nature is maintained, which means regularly there is destruction and repair. This process of destruction and repair can be faster in some tissues, can be slower in some other tissues. So in the cartilage, it's very, very slow. But for the cartilage to remain healthy, there has to be equilibrium between destruction and repair. And that's why we are seeing very healthy cartilage here, very smooth. There's in this hip joint, there's enough joint space, the ligaments are normal, and all. This is a healthy hip joint, for instance. If anything happens, the destruction becomes more than the repair. This healthy joint will begin to have wound. So it means as it's being destroyed, the body is not meeting up with the rate of destruction. So as it's not meeting up with the rate of destruction, there will be a deficit, and that deficit will come out as what? A damage. That is how arthritis starts. Okay? I want to use this slide to also demonstrate more, so that I can understand where we are going to. This is a very healthy cartilage. You can see the chondrocytes. This is a normal healthy cartilage. Okay? In this slide A. In slide B, there's a wound. Okay? There's a wound that has occurred. The body naturally will trigger the repair process. There are chemicals that will be released because of this wound that has occurred. It will all go here to stimulate the proliferation of these chondrocytes. They begin to proliferate, growing more cells, just as I demonstrated earlier on. The idea of the whole thing is to fill up this wound here. And in that process, to encourage healing, there are many things the body does. One of them is there's formation of new blood vessels. Okay? It's just like when you are piping water to your garden, to spray water to your garden, so that in the dry season your garden will still be very green and luster. Okay? So the body will also pipe the blood vessel to that place or that joint or that cartilage that has wound. What the blood vessel does is to bring in blood, which carries nutrients, oxygen, and other healing factors, and even stem cells to encourage the healing. All right? So that is what is known as angiogenesis, to the formation of new blood cells. Okay? Okay? To highlight it more, I'm bringing up that slide. So in this slide now, you can see those new blood vessels that are formed. All right? So these blood vessels will bring in nutrients, oxygen, stem cells, healing factors to this cartilage to encourage it to heal. All right. So if anything happens, which is where the painkiller comes in. When we take painkiller, yes, it helps us to feel better. And that's what I call deception. That moment when you take painkiller and you feel better, you are not feeling better because the disease has been taken care of. No, you are feeling better because the symptom of the disease, which is pain, has been relieved momentarily at that time. The danger of that is that even when you are feeling better, you think everything is fine, you go about your normal business, continue to mount pressure on that joint. That excess pressure mounted on that joint will even cause more damage. And number two, another thing the NSAIDs do is that they go to block the formation of those new blood vessels. So if that new blood vessels are clipped or their formation is hindered, it means the rate of bringing in nutrients, oxygen, for the regeneration of damaged cartilage or tissue will be hampered. And here you can see the damaged area. All these places are still fine. But because this painkiller has clipped this blood vessel from bringing in the nutrients needed to heal that wound, the damage gets worse. So that's one other thing the painkiller does. And unfortunately, that's the major drug people take. And it's not surprising why people believe that arthritis has no cure. Because when you are taking these medications, it is even worsening your arthritis, and they think there's no solution. No, there is. Okay? So, what the painkillers or the NSAIDs, what they do, they inhibit the proliferation of the chondrocytes. They inhibit the synthesis of cellular, matrix, that ground substance where the cells have their nutrients and swim around and have healthy environment to grow and all that. There's also a chemical that's needed in the formation of cartilages, which is called the glucosamine or glucosagglucan. So it reduces or inhibits the synthesis of that chemical. Even the formation of collagen, which is one of the major fibers in your ligaments and the cartilages and bone, it hinders the formation of the collagen. Okay? And even proteoglycans that are also needed in the formation of those. So every substances that are needed in the formation of the new tissues of the cartilage and the ligaments are hindered by the NSAIDs, by the painkiller. Okay? So when that happens, that small wound we had in the joint, before you know it, the entire joint is completely degenerated. There's no more cartilage here. The joint space has narrowed. This person to walk becomes difficult. And meanwhile, the person thought that he has been taking treatment all this while. And by now, he will believe there's no cure. So at this point, since the drugs can no longer help, what people used to do is to subject this person to surgery. Because that's what you have to do to cut off this head of the femur and replace it with artificial material. Okay? So because of that, more people on NSAIDs will end up with joint replacement surgery. And that has been the malady in the past. A lot of joint replacement surgery going on because of prolonged consumption of painkillers. And Dr. Rausa has this to say: if NSAID use continues, then most likely the exponential rise in degenerative arthritis and subsequent musculoskeletal surgeries, including knee and hip replacement as well as spine surgery, will continue to rise as well. Therefore, this lecture is to help us, is like a warning to help us to be careful when we are taking painkiller or depending on painkiller as a solution for our pain. Because that painkiller you are taking, instead of making your pain better, can even make the pain worse. Thank you very much. I believe you learned something from this lecture today. See you in our next lecture.